With over $2.8 trillion spent on healthcare in 2015, there is no wonder why healthcare is a major problem. But could there be a solution? Healthcare has been a topic in this nation throughout the 18th and 19th century, but didn't gain debate popularity until the 20th century, the federal government not financing or providing it to the public. In 1915, the American Association for Labor Legislation produced a series of bills that provided state medical benefits to low-income people, and Charles Edward Amory Wilson, the chair of Department of Public Health at Yale University, wrote, "Enable every citizen to realize his birthright of health and longevity." The idea of government-funded health insurance came into play by Theodore Roosevelt's Committee on Economic Security, but didn't come around as a part of the 1935 Social Security Act. It wasn't until the 1960s where healthcare became government-funded because of the King-Anderson Bill, a bill that would extend Social Security to cover medical bills of Americans over the age of 65. This bill, signed by President Lyndon B. Johnson on July 30th, 1965. 6 years later, the idea of universal health care came around through President Richard Nixon's National Health Strategy. He said, "Reform our health care system so that every citizen will be able to get quality health care at a reasonable cost, regardless of the income and regardless of the area of residence." His plan sought to be financed through taxes, but no health care legislation had been implemented at that time. President Clinton in 1993 picked up after Nixon's idea of universal health care and created the Health Security Act to move the United States towards universal coverage. In 2010, President Barack Obama came up with the Patient Protection and Affordable Care Act, which signed on March 20th, 2010, and according to the White House, an estimate of 27 million people were uninsured before the Affordable Care Act. But despite this expansion of healthcare coverage, more than 29.8 million people still remain without healthcare today. So the question is, does it still work today? In 2010, the U.S. spent about 17% of our GDP, and in countries like Canada, France, Australia, and the Netherlands, they spend about 10% of their GDP and have better health insurers than we do. Around 62% of the individual bankruptcies caused by medical expenses, according to a 2011 report of 34 member states of the OECD, Organization of Economics, Cooperation, and Development. The U.S. ranks number 1 per capita healthcare expenditures at $8,508 per person. The U.S. healthcare spending is financed by a mixture of households, which is 28%, and federal government, which is 26%, businesses 21%, and states and local governments 18%, and other private sources 7%. So what could be a solution? The solution is that you could allow some choice in the system, which allows for competition. This gets rid of government agencies, bureaucrats, and corporations. An example could be if you were in an industrial corporation and you get a lot of injuries such as broken bones, you could get healthcare plans that cover expenses for injuries that occur in your job. Or say that you're diabetic, you could get a plan that covers the expenses of your insulin or medication that you take. The system of pick and choose healthcare would reduce the cost of monthly premiums and reduce the amount of money the U.S. spends on healthcare. For further information, visit these websites. Thank you for watching.